Hello everyone, I'm Dr. Prateek Joshi. This patient sustained twisting injury to his right knee joint, and as we can see in the diagnostic arthroscopy, in the lateral compartment, the lateral meniscus is appeared to be torn. There is a longitudinal tear involving the posterior horn and the body of the lateral meniscus, predominantly in the white zone. As you can see, we can displace the torn portion of the meniscus with the help of a probe. Ideally, we should try to preserve the meniscus as much as possible, especially when the patient is in younger age group. However, in this case, the patient has made informed decision to go ahead with partial meniscectomy after having discussed in detail about different options at hand. The arthroscope is in the anterolateral portal, and I have introduced the arthroscopic punch through the anteromedial portal. Now I am taking bites in the meniscus at the anterior most portion of the tear. So now you can see that we have separated the torn piece of meniscus from its anterior extent, and now a small bridge of meniscus tissue is present at the posterior portion of the lateral meniscus. Now I am seeing through the anteromedial portal, and I have introduced the arthroscopic punch from the anterolateral portal. So now I am going to take arthroscopic punch and take bites in the posterior horn of the lateral meniscus in order to separate the torn piece of the meniscus. All this while we have kept the knee in the figure of 4 position in order to open up the lateral compartment of the knee joint. We should always be careful not to damage the cartilage of the tibial as well as femoral condyle. So now we are about to complete the partial meniscectomy of the longitudinal tear of the lateral meniscus, and then we are going to take out the piece with the help of arthroscopic grasper. After we have taken out this piece, we are able to see the horizontal tear which remains in the lateral meniscus. So this makes the whole tear pattern as a complex tear, because it is combination of horizontal tear with longitudinal tear. In this case, I am just going to trim the superior lip of the lateral meniscus in order to just make it stable enough so that it doesn't come in the joint when the patient flexes and extends the knee. Preserving the lateral meniscus is even more important in comparison to medial meniscus, because the tibial plateau is convex in this region and the femoral condyle as usual is convex. So the lateral meniscus plays an important role in making the lateral tibiofemoral compartment a concavo-convex compartment with congruity. At this point again, we should try to repair this meniscus by putting multiple longitudinal mattress stitches. But again, we are just going to use arthroscopic shaver and punch just to balance the meniscus for it to not cause much trouble in future. This is the final picture of the lateral meniscus. Thanks for watching this video. Do like and share the video and subscribe to the channel.